Okay, very good, sir. Hi, how are you? And welcome to a special, beautiful, amazing holiday edition post Thanksgiving and pre Christmas of the radio show. And well, all the best. And in the meantime, we do have a wonderful crew here to talk about the holidays and to talk about some of our favorite things. Dr. Norm Shealy, the one and only, and of course, Rachel. How are you? Wonderful to have you. Well, not first time that the three of us have gotten together here, which is wonderful. But uh, I'd like to dedicate this show to an upcoming 90th birthday, literally upcoming in about 4 days, of Dr. Norm Shealy himself, the man, the legend, and there's many things. Speaking of the legend, that he has accomplished. So some of the things that we're going to talk about is well, let's talk about the celebration of life and accomplishments of this incredible man. And Rachel, of course, feel free to jump in. You know more about us than
Well, Dr. Sheila, I had a very good conversation on the way over here too, talking about his history of longevity in his family, and we didn't get to dive into all his amazing inventions though, so I want to ask him about those.
Indeed, my mother lived to be 97, and my great grandmother lived to be 106. So at age 12, I was allowed to read his diary from my great great grandfather, and he lived to be his late 90s. Interestingly, my father was a wonderful man, but he died at 53, smoking 3 packs a day. And when I was 16, he said, Norman, if you will not smoke or drink until you're 21, I'll give you $1,000. He couldn't have paid me $50,000 to smoke. But interestingly, I've always been interested in longevity and health. At age 4, I declared to my family that I was going to become a physician. At age 16, I decided to be a neurosurgeon. And, I've enjoyed, all these years.
Let's go back to a very interesting time in history, a time when Dr. Shealy invented or came up with a concept of a tens unit.
Well, I spent 3 years evaluating research in electrical stimulation of the brain in animals. And my first paper was on this effect. And then I came up gradually with the idea that we could inhibit pain by stimulating the dorsal column of the spinal cord, but even stimulating the body, specific places. We had 40 different points in the body.
So that's the dorsal cord stimulator that you invented.
Yes.
So okay, and
So that's another one. By the way.
yeah. You have so many amazing inventions. I think they still use that now, don't they? Sometimes spinal
it's still
was
used,
the basis for spinal stimulation.
It's inserted through a needle in the spinal column, but I almost never recommend it anymore compared to the PEMF device.
Sure, that seems less invasive.
Yes.
Yeah, I can take that.
So there was the dorsal cord stimulator, which was an invention or concept, with a gate theory of pain concept, in other words, and that worked really well. There's a lot of procedures being done around the world, as a matter of fact. There's also the TENS unit, which is not invasive, and that was another concept that you came up with, again, back in decades ago.
Yes.
And that was an interesting concept as well. That is actually all over the world, basically everywhere.
Interestingly, I took this to Medtronic, the pacemaker company. They told me it was not patentable, and they patented it without my name.
Oh.
And, so it goes. I've been very careful with my inventions since then because it's important to document this origin and benefits of individual thing. I introduced electroacupuncture, first person to put needles in and stimulate acupuncture points. And when I introduced this to neurosurgeons, oh, well, you've only done the animals, you know what you're talking about. But a couple of years later, when I did my first patient, everybody in the room wanted to do it.
Oh, God. And that eventually also led to the concept of evolving the electroacupuncture to something even better, which is bliss oils.
Yes.
And then you came upon the concept of bliss oils, which is combining the essential oils with 12 to 13 points on the body,
Yes.
acupuncture points with 5 different effects.
And it takes 30 seconds to do a circuit.
Yes. And one of those is actually air bliss. There's a reason that I'd like to talk about that. There's 5 of them altogether. But air bliss is a wonderful invention. And what that does is, interestingly enough, of course, having a neurosurgery and background and all of this and, wonderful training, Dr. Shealy, of course, is interested in the brain more than anything else for the most part. Well, not we cover a lot of ground everywhere, but one of the things that Dr. Shealy is absolutely well aware and known for is the nervous system, self-regulation, and literally bringing the body back, allowing the body to come back into the homeostasis.
Yes.
And that's part of the bliss oils and the 5 circuits. Air bliss. Can we talk about air bliss a little bit?
Well, interestingly, we first tested on telomeres the tips of your DNA, and we found that fire, air, and crystal stimulated daily would grow telomeres longer.
And those are the 3 of the bliss oils. Then there's water bliss, which stimulates, it's aldosterone, and it's literally water weight. Anybody who's got, puffiness in their body or just excessive water retention, blood pressure, that's also another application of that may help with. Again, of course, everything we talk about, we're going to say may assist with because of our, not so friendly, federal death administration known as FDA and then CDC and so on and so forth. But again, that speaking aside, and if you can read between the lines, again, the concept is there's simple, effective things that are very easy to do and that are so good for our health
and safety.
And
the top of the list.
That's the best part, where it won't hurt and it may help. Yes.
Mm-hmm. Interestingly, I've even cured a severe allergy to cat by having a friend use it.
The PEMF device.
Yes.
Okay, let's talk. Let's get to, since the PEMF is a topic that seems to be coming up so much here in this conversation. Let's jump right back in, right into it. How did you initially come up with the concept of a PEMF? Let's talk about the origin.
About 25 years ago, I was walking, somewhere, and I had this idea, we must relate to Earth frequency. Earth frequency is 7.83, and I assume that each chakra, there are energy centers in the body, 7 chakras, and each would add 7.83, but plus or minus 2. So it's 7.83 plus or minus 2, and again 7.83 additional ones times 7 plus or minus 2. And eventually I found an engineer who would make it for me, and indeed it's called the chakra sweep initially because it sweeps those frequencies. And PEMF, pulsed electromagnetic frequency, is the grand culmination of that.
Well, I was just going to say, so would you, earthing, grounding, that's kind of like a big thing when people talk about walking barefoot on the earth and doing that.
Well, no question about it. For instance, you could sleep on these frequencies with a mattress. It costs $4,000, but an hour at night, sleeping on it will lengthen telomeres.
And that's okay, right? But the PEMF is a similar idea to grounding.
Similar
or
idea,
earthing
and you don't have to do it.
This is what I find, and this is actually fascinating to me. I normally get out in nature somehow, at least a couple of times a week. Whether it's my own backyard and kind of go out into the woods, or go to a park or do something with the family. And it's a wonderful one thing. But with the colder weather and we just hit a really busy season, so I haven't been able to get out of the house, which is terrible. So what I've been finding out is that. When I wear the PEMF, I feel good. When I don't, I'm restless. There's just something that's just not right. And there's a little something about nature that we're missing, or a lot, because we're as human beings, we are supposed to be part of nature. We belong. But please, when we get separated,
it's proven to
Yeah.
create stronger bones, increased beta endorphin, the pain reliever, sleep and growth hormone improved, increased energy, better oxygenation, improved strength, relaxation and sleep, and everything in the body is electrical and good.
I'd like to jump in with the concept. Rachel, thank you so much for the concept of grounding. Absolutely right on. And this is the major concept behind the first mode of this device, which is 7.83 cycles per second Schumann frequency. Without grounding, there's been actually experiments done in the 50s when Schumann frequency was discovered, where they put students in bunkers and frequencies, including Schumann frequency, and then they reintroduced it. And when they took that frequency away, people got sick. Young, healthy people. And then with the reintroduction, it got reversed. So the other concept is this space programs, NASA. You send out very healthy astronauts who are able to handle a lot of physical things, and they came back literally falling apart. I mean, literally, the body falling off the bones. I mean, that's just the best way I can describe it, literally. And so again, so since then, and the understanding that the Schumann frequency is so important for humans. And how many of us are stuck inside, or basically dealing basically with technology, computers, all sorts of unnatural, so to speak. I shouldn't say unnatural. I mean, but not created
Not
by
out in
nature.
as often as we should be.
Yes.
Or should be. Yeah.
Yes.
In the summer, I get 2 or 3 hours in the garden every year, or every week. But 6 months of the year, you can't work in the garden.
Yeah, it's not where we live. It's not really conducive for that. Dr. Shealy, I had another question about that. So, legend has it you've written how many books?
60.
Okay.
Actually, is it? I think. Well, that's a lot of publications.
He's written
but,
publications. Okay,
oh,
yeah, I
yeah.
said books. I think publications. Yeah, it's the line gets a
350.
little blurry. when we-
research articles.
Yeah,
of
but-
that,
So
yeah.
what I have heard that you wore the PEMF on your head as you were writing all these things. Is that true?
Well, essentially, I discovered it first and created it second.
So here's what Rachel is referring to is the gamma mode, which is one of Dr. Shealy's favorites and one of our favorites. And we can talk about gamma. It's a 40 cycle frequency. It's literally the frequency of optimization of the human mind. It's the place where meditators are. Please.
Well, Buddhic meditators for 8 hours a day do gamma, and you can't do it. You don't have 8 hours to contribute to it.
Most people, yeah.
Most of us, that lifestyle does not work.
So that's and again, it doesn't replace the benefit or the value of meditation or mindfulness. We should be meditating and mindful through every moment
Which
of
I
life.
should say is front facing talking to patients in the clinic, a lot of our patients like to wear that while they're meditating.
Yes. Yes, and yes,
Yeah.
and that's exactly and the more spiritual people or more aware people, everyone is spiritual. That's the concept of the holism. We are spirit soul, so by definition we're spirits. We're not spiritual, we are spirit. And then there is the mind, which is the mental control. It's the it's the control center, literally. That determines everything else that happens physically, literally everything that happens physically. And then, of course, there's physical factors. One of the things that actually I'd like to talk about as well is also an integrated mode, or what we didn't understand fully what the benefit was, and that's a third unit, which is a delta mode. So initially, how that came about. Shealy has been very fond of the gamma, which is why we introduced that, and it's a wonderful for also depression, anxiety, mental health, lots of different things, but also optimization. It's not just for the sick people; it's also for those who want to do better and to utilize that wonderful brain bucket that we have. But there's also a time to rest and reset, because without rest and reset, it's a balance. There's a daytime activity. We want to be awake, alert, functional. And at the same time, we also want to be able to, at night, get a good night rest. So that's how we put together and introduce the third component, the third mode into this device, which is Delta, 0 to 3 cycles per second, stage 3 deep sleep support and relaxation. But not just sleep. If you want to just relax, you can, or calm down the mind a little bit, overactive.
We actually had a question today. Somebody wanted to know, do they use that mode with their PEMF before they go to bed, or as they're going to bed, or all of the above?
Yes, and I get that question a lot. So let me address that. And I'm sure Dr. Shealy would agree, but of course, please feel free to contribute as well. My suggestion is this. This is how I do the unit, and this is how a lot of my clients do the unit. Again, just experience. But again, it's not the only way. At night, you're going to be in bed pretty much, or I imagine you're going to be in bed or some kind of a flat surface, and in one spot. So it's a wonderful opportunity to charge the unit, and as you're charging it, I keep it in the delta mode, 0 to 3 cycles per second. That literally just helps me to just shut down all these crazy monkeys all running around there. I mean, for lack of a better term, because this brain is quite overactive, just to be frank. And when I wake up in the morning, I'm not typically a morning person. Some people are. I generally need a gamma just for the first couple of hours as I get up. And because the unit is charged, I have 6 to 8 hours of battery life. So I literally wear just like the Shealy does around the neck. It's portable. I've gone through security, airports wise, and everything else. It's an interesting piece of conversation when you go through security. By the way, it's just FYI. If you're not interested in conversation, you can avoid that. But it's the short of it is that I start with gamma, and then after a couple of hours, when I feel that I've woken up sufficiently, or I'm in the zone, or sometimes I stay with gamma most of the day if I need to be focused. But in general, I love the regenerative mode. I love the sweep mode. And sometimes, some days when I'm going through a lot of stress, a lot of pressure, a lot of problems, or just basically emergency room shift, followed by clinic, but followed by other things, followed by you name it. I keep it in the regenerative mode, in the sweep mode. So there's no wrong way to use it, but it's just a wonderful, wonderful, wonderful unit, and it's something that can be very, very helpful. And so with that, I would like to kind of summarize and just to say that in light of Dr. Shealy's 90th birthday, and this is the last opportunity for this offer. If you do want to take us up on this offer, there is a 15% off on the PEMF. $240 off. I'm not really great with mathematics, but I think that's what it turns out to be. The other things that go with it, and I just want to outline that right now, is we talked about the self-regulation, biogenics. We talked about the entire program, that PhD thesis at some point in the past, where Dr. Shealy has put together, designed, and now over 68 various exercises guiding people to literally reset the nervous system, autonomic nervous system, the stress response, and gain mastery. Literally, we're talking mastery. That's what it's all about. If you're interested in mastery, then keep listening, because this is wonderful. If you're not really interested in mastery, then of course, this is what it's all about. The another course that is available here, complementary as well as biogenics course with this offer until the end of the month, or one day left, literally, is Dr. Shealy has put together, and myself, something called Youthful Longevity. That is another wonderful course where we discuss and we put literally a lot of detail and information, and what we talk to patients and our customers about, and what we've done in the workshops as well. And what that is a wonderful opportunity to dive into literally lifestyle optimization of DHEA and the stress wellness hormone, how you can do so naturally, and how you can literally live to 100 and possibly beyond, especially certain combination of other products such as bliss oils, what we mentioned. So another wonderful course that is included in this offering until the end of this month is personal intuition. And Dr. Shealy has been huge into personal intuition, been teaching it, been working with it, even medical intuition per se. And there's some very high-end, very successful people who came around as a result of that training, helping a lot of folks. And the idea is, if you can learn to trust yourself, if you can learn to trust the inner guidance, inner voice, and clear all the nonsense, make better decisions, get to better outcomes, you can literally change your life. You can create the life that you want. So the combination of these three courses, plus part of the offer is introduction of. It's a bottle of essentials, which is the basic B complex. You gotta have a good B complex every day, not occasionally, every single day. It's like trying to drive a car without fuel. It doesn't work. I mean, you may want to try, but it's not going to work. That's just it. The second thing that is included supplement-wise is a youth formula, combination of vitamin C, MSM, methylation support, and that combination raises DHEA by 60%, in addition to helping with the immune system and clearing free radicals and all of those things. So literally, youth formula for being youthful. And another thing that's included is another one of Dr. Shealy's discoveries, which is magnesium topical, not by mouth. And I'll talk about magnesium. I do take magnesium by mouth at times. And I do that when my bowels are not functioning properly. Let's say I haven't had a chance to eat. Let's say I run a 24-hour ER, and again, it just messes up the system. So what happens in that case is it helps to balance and pass things along. But here's the thing: just think about it. If it does such a good job passing through the system, it's not staying in your system, is it? Okay, to a large degree. So how do you get to the cells? Because we are deficient. 80% of people are deficient. Again, topical magnesium chloride. That's another way to raise DHEA, and that's also part of the offer here. And last but not least, there is also an Air Bliss oil, which is a wonderful combination of essential oils applied again to about 12 circuits, and it raises two very important things: neurotensin and oxytocin. It's and as Dr. Shealy describes it, it's literally the bonding, nurturing hormone. It's basically when a child is born, it's what the newborn mother feels towards the child, and vice versa. It's that literally falling in love. So why not fall in love with your life, with everything that's around you? Make the best of the world. So literally, and this is a wonderful opportunity to dive into the weekend, especially if you haven't been exposed to holism yet, or some of the modalities or pathway or things that we do. And that's a really good way to just get right in and to get started. So if you want to do that, there is a link down below, and please take advantage of the opportunity because it's going real fast.
And it comes with exquisite
instructions. Yeah, and there's a lot more detail than what I'm able to talk about right now specifically, but it's just given the time limitation, there's a lot to cover here. It's a big conversation, but we are happy to take questions in the next half an hour, in the next We're still working on capacity in our studio to take phone calls. It will happen. I got faith. We got some of the best people in the world right behind us. Matt, there you go, brother. All right. But in the meantime, please feel free to send your questions through the.
And while we're waiting for questions, I'm going to ask some questions that maybe people that are listening that aren't able to get to their computers and type.
Please.
But so one of the things is, and it's like important tips for good results. It does hydration. Does that matter to make this?
Yes,
Okay.
critical.
Critical. So being well hydrated is very
Yes.
important for this to work well. So drink your water. Okay. Very good.
But at the same time, I also had a question. I'll clarify. I had somebody tell me, I'm not going to use the device because I haven't drank my water today. That doesn't make much sense either. It works better when you're hydrated. Well, we're 70% water plus.
So for optimal performance, be hydrated.
But if you
Yeah.
didn't hydrate,
You can still use it.
you can still use it. It's
Yeah.
still a benefit. There's a question. There's a question from online. Actually, I'm just looking here at. Would PEMF help to heal bone damage from multiple myeloma? I would say it may certainly, absolutely do
Yes.
so. Yes. Again, we're not.
Definitely.
And I'm not. Again, because our friends, the three-letter agencies. Well, not so much friends. Again, please, read between the lines. May assist with, but we're certainly very hopeful. Yes.
Yes.
Mm-hmm. Wonderful. The other thing I'm going to say is it's really good with the recovery from musculoskeletal injuries or chronic pain or chronic, bone and joint issues. And personally, I was able to get back to emergency room work after 4 weeks after a blowout lumbar L3 fracture. You're a neurosurgeon. You've been a neurosurgeon for a long time. How often do people get back to work, especially a medical emergency room, after 4 weeks of
Never.
Okay. Well, okay. Thank you. Yeah. But again, it's not just that. I did a lot of other things. It was a lot of mental, emotional, plus some other modalities. But bottom line is, it's possible. It is possible. Another question: does the gamma mode number 2, which is gamma, help to clear the cells out and heal the body like number 1 Shealy sweep? I'm going to say that I'm going to focus on what we know. Gamma is a wonderful, wonderful frequency, around 40 cycles per second. What we know best about it is that it optimizes the brain function. It optimizes the mind. It optimizes the central nervous system, and it may be helpful in some other things, but we haven't done the research on that. So what we do know for sure is that the Schumann frequency is definitely would be the best recommended one. Now, if you find benefits with a gamma, I would love to get more case reports, and I would love to get more data on that. Absolutely. Again, possible. And again, I just cannot make any statements without having data. That's the one thing that I've learned from Dr. Shealy. You don't make any statements without research. You don't make any statements without knowing that you're doing the right thing. And 2 rules. Primary rules of holism: do no harm, and whatever you do, make sure it has a potential benefit. That's all.
I think it's time to mention locally the Spring Valley. It's the best health food store in the world. You walk in the door and somebody immediately comes and asks you, "Can you help?" I mean, you could find nothing with that 10,000 items looking through. But Spring Valley Natural Foods, and they do not carry the PEMF device, but they carry all my other supplements, and it's critical. And Coloma Frozen Foods tart cherry juice concentrate I've been taking personally for over 20 years. It's excellent for improving circulation.
Wonderful. There's actually another question that has come up, and just to touch base on more about Dr. Shealy, because there's a lot of interest about the TENS unit, and people don't understand fully how the TENS unit really works. A lot of people don't get it right, actually, and that's why it's so ineffective. People
Right.
say, I tried the TENS unit, it doesn't work. Or it helps a little, but it stops. That's not how you're supposed to use that.
Well, you must use it in an informed consent. And if it's the lower half of the body, sometimes putting it on the ankles bilaterally. For the upper body, it front and back of wrist. But dozens of other possibilities, and you need somebody to instruct you how to use it.
The other thing I'm going to say, and please feel free to jump in, you're supposed to use the TENS unit 24/7 all around. It's literally supposed to reset those gate channels. It's not a pill. It's not a 15-minute prescription. So that's number one. So that's a misunderstanding. But that's what happens when a major company steals an invention and goes wrong with it. Go ahead, please.
Oh no, I was just gonna say it's really interesting because here Dr. Shealy is local, and I mean, having taught or coached high school track runners and athletes and stuff, everybody had access or used a TENS unit. Like, it was such a common device. It's kind of amazing that you go to a chiropractor office, you're gonna see it there too. Like, I don't know, it's pretty neat that he's here local with us.
Now, it's and yet, despite the fact that the TENS unit is all over the world, your favorite device still is the PEMF, isn't it?
Oh, definitely.
Yeah.
It's the emperor of electricity.
Yes. So basically, the fact that literally, and the difference is the TENS unit is. For people who are watching, you can actually see that Shealy wearing a device. It's portable now, so it's been charged. So, and again, what happens there is the TENS unit, you actually feel the electricity, you feel the tingle. And how you work with the TENS unit, again, just to contrast, because we get a lot of these questions, and I do want to make sure that I address that. When you have a TENS unit, you turn it up, you apply the electrodes, as Dr. Shealy said, preferably to certain acupuncture points, not just to random areas, but you can certainly put it on the area around the pain, like say up and down or side to side, or basically just cover it from side to side. So electricity. This is not electricity. This is magnetism. So right now you don't feel any electric shocks. It's just maybe it's a little warm. But if you take a little magnet, a small magnet, and you literally hold it to the unit,
I brought one in so they can see it.
Yeah, the little vibration there.
Yeah, it's always fun to show the patient how it's
You
moving.
don't feel anything.
No, you don't feel anything, but it's working. As soon as you put the magnet up there, you see it start going crazy. Yeah,
Yes.
Yeah.
I had I had one of the interesting stories with Dr. Brian Daly. Do you remember? He's actually the one who introduced Dr. Shealy to me, or meet Dr. Shealy. That's how I'm able to be here. So Brian, so Brian was my medical partner before, unfortunately, and his story is fascinating, and he gave me permission to share this. And at some point he said he'll send his total account of what he's gone through. But of all the things that he's been through, he just happens to be a diabetic. I'm talking about Brian. A lot of diabetics have vascular endotheliopathy and ulcers and, well, lots of issues, vascular, micro, macro, lots of different things. So Brian, unfortunately, has a later stage diabetes with a lot of complications, including some vascular procedures. And one of the things that happened was that he wanted me to share this with the world, and share at least on the broadcast, is that his older unit, he had one unit for a number of years, it broke or it stopped, and it happens. It's devices happen, and as soon as that stopped, the neuropathy and the pain in his legs returned, and it was terrible. And this is a tough guy. This is a tough, wonderful, beautiful person. So we immediately, as soon as he notified me of that, we immediately shipped him another unit. And he just went for another procedure, vascular procedure. So he's literally going through a world of hurt right now. And as soon as he received the unit, he left me a message. It was a beautiful message. And Brian is not a very emotional person on a regular basis, but that was just a wonderful conversation. and he just literally wanted to share what it did for him because it's just it's incredible. Really, no pain again, or almost no pain, and healing much faster than anticipated. And again, that's what we're going to see. By the way, diabetic neuropathy by conventional standards and means is not reversible. So I'm going to say again, in the words that again read between the lines, it may help to reverse that, or it may assist with. But a lot of folks end up with a wonderful relief of symptoms, but also improvement of function. One of the things that you mentioned initially with the PEMF unit is that it was a diabetic, and you applied it to the feet, and the person had no sensation whatsoever. So the person had lost, the neuropathy was terrible, and what did the person say?
Well, he started, my feet are alive.
That's good.
Wow. Yeah.
Yeah, and just think of it this way: if you can improve circulation to the feet, which is one of the harder places to get circulation to, I mean, just physiologically.
Gravities.
Yeah, and as a runner, I mean, my God, yeah, exactly. You can, I mean, just everything else. So it's great for people with vascular, heart, all sorts of things. Short of it, if it works on a cellular level, so that's the key. Now, let's see. Do I
Got a question?
have another question? Okay, yeah, got it. Okay, since gamma helps with the brain, will it help with a Parkinson as well?
Interestingly, all kinds of movement disorders. My favorite is a man who was so bad he couldn't stand or talk at all. In 1 month, he walked into the clinic.
His primary diagnosis was Parkinson's, wasn't it?
No.
No?
It wasn't Parkinsonism. It was some other degenerative disease.
Neurodegenerative.
But I have
Yeah.
great help with it, Parkinsonism.
As well. Okay, that's amazing. That's amazing. And I think I think I remember that the office still talks about that. How the person who had to be carried in the first time around walked in. To us, that's a major success story. I mean, you might not be running a marathon. I mean, as you are, but
Well, and this is probably a lot of people have these questions. Again, me being kind of front facing with the clinic. If somebody has that issue, a lot of the questions we get are, how long should they apply the PEMF device?
Well, I think personally you need to use it a minimum of 2 hours a day and up to all day.
So there's no maximum, a minimum of 2. And then another question we get a lot is also application. You've got it on, you've got clothing, but they ask if it can be on skin contact, direct skin touch.
Yes, it's
Right.
totally safe.
yeah, you could, but you don't have to. Now, even if you put it under the pillow, it goes through. This is what we're talking about.
That's
It's
another
not.
question we get, yeah.
Thank you, and we'll keep going because you get a lot of questions. Actually, I'm glad you're here because let's actually answer a lot of the questions, or let's address some of the questions that we're getting from the clients because it's inevitable. There's going to be some kind of clarification. The electromagnetic means you don't have to have an electrode right next to your skin. Actually, as a matter of fact, there's a six-foot effect. Now, the closer you are to the organ, to the place, the better off. So for people with diabetic neuropathy in the feet, they keep it in the legs.
And I should mention the only contraindication is in an implanted pacemaker.
But the reason for that is because the battery in the pacemaker. Yeah. But actually, I just came across. I talked to several engineers, as a matter of fact, recently, and no one has any significant concern about 0.2 gauze with respect to the device, harming the device or changing the device. But again, it remains a theoretical consideration.
And
So
would that be anything battery operated, like an insulin pump or something? Like that?
anything. That's
okay.
exactly it, and that's another common question that we get. Now, do we have people who use that without telling
issue.
us? And then later I talk to them and they're like, "Hey, this is nice ever," and I'm like, "Don't you have a pacemaker?" Yes. You didn't. You didn't tell me that you got the device. And I love it. I'm not giving it up. Okay. All right. Great. But again, it's like I said. Another category is pregnancy, by the way. But the pregnancy is one of those things. Is again, and we just can't recommend anything in pregnancy.
No, I wouldn't yet do the research even on pregnancy.
It's just so complicated, and so I mean, so many variables.
Yes.
Yeah. Yeah. And what are some of the other questions in the?
I mean, I think I've covered most of them. Then we get a lot of again, doesn't need to go on a specific spot, but I think we talked a lot about that. So just what you're trying to address and what issues you have. Something else that we do get a lot is I'm using the gamma for this. It's not helping. People are sometimes afraid to play around with the other settings. So what is your recommendation for that? Or their delta or what, I'm using this for anxiety. It's not working.
The chakra sweep.
Okay.
It's the best.
Okay. So that's something people should experiment with before
Yes.
they. Mhm.
There's another question here. There was a mention of allergies. Is PEMF safe for someone with a mast cell activation disorder? Mast cell is an allergic immunological hyperactivity. Literally a hyperantigen, in other words, activates a storm inside the body, and you've got terrible things, including cytokines and all sorts of mediators. I mean, the immune system is just wonderfully wacky and wonderful, but can go off kilter within a second, literally. So one of the things that the PEMF does is, again, cellular stabilization. If you can stabilize the cell, you can help things that happen from the cell, which is, again, histological, immunological, and just all sorts of responses. Literally, I wouldn't use it as an emergency treatment if somebody's having an emergency reaction. Let me just kind of clarify. I wouldn't say put the PEMF and use that as a treatment. I mean, it's okay if you have it; it may help. I mean, you should certainly get help professionally and medically, but there's no harm. It may certainly be helpful as a part of the overall.
And my one friend now sleeps with a cat.
Oh, okay.
And he was highly allergic to it before.
Now, speaking of cats, and I love cats, by the way. It's my favorite. One of my favorite animals is between cats, dogs, and even cattle. I mean, it's just the frequency is not just for humans, is it? Yeah, we've had a lot of reports of
Absolutely.
how many. Rachel, I know you hear a lot. You're a lot more in the front. So I mean, how many people talk about pets and
A
PEMF?
lot of people use the PEMF for their pets.
Oh, yes.
Yeah. Mhm.
Especially in dogs.
Yes.
But it's good for any animal.
But I will say, if you call and ask us specific questions about how to use it for your pet, I don't think we have the research on that. So
It would be a wonderful thing to do, to get some research done by a veterinary specialist.
Yes.
Would love to see that. But unfortunately, we can't make any official statements on our furry friends, other than we love them, of course. It's. Let's see. I think we may have another question. Okay. All right. What setting is best for pain?
Well, pain is best for the delta frequency.
Agreed, especially neuropathic pain, because all pain has to communicate from the physical body through the nerves into the central nerves, brain, and all sorts of wonderful neurochemistry that goes with that, and all sorts of connections. So when you have a chronic pain situation, now pain. We should clarify. There's acute pain and there's chronic pain. Acute pain, let's say you break a bone. Okay, well, please use the device. I mean, it's very helpful. It may be very helpful in healing, but again, it may not be as good for the pain as a pain medication in that situation, because you're having an acute situation. If you have a chronic pain, you're generally dealing with a neuropathic component, or the activation of the nerves that basically have entrained themselves to be painful. And there's this, whether it's a stimulus or whether it's just a conditioned response. And so one way to reset that, I would say, to me, would be delta.
Oh, yes.
Or the third mode. The other mode that would be very helpful, and what I've been using as well, is the sweep mode. Now, in general, I think the sweep mode is a good default for everything.
Yes.
Uh,
I use sweep almost exclusively.
Almost, yeah. But you do like your gamma.
Yes.
Yeah, and the reason, and I'm just gonna throw it in there. Pain is a subjective experience. There's three of us sitting here: Rachel, Dr. Shealy, myself. We each have a different perception and understanding of pain. You can, if somebody connected us to say some kind of a device and pushed a button that activated some kind of an unpleasant reaction, same stimulus for all three of us, we would each experience in different ways, and we would respond in different ways. Now, I'm not saying we should do that. That's not nice, but
I'm
just
not
say,
signing up for that experiment.
No,
I think
no,
I have a
no.
high pain tolerance, but
Yeah. So I agree. I wouldn't be part of that research either. But it is, it is a wonderful concept for that. A few more questions. Again, go over the three modes. Okay, the three modes again. Let's kind of cover this again. The first mode is the sweep mode. That's a general, and that's your
that's the
Schumann
one
frequency.
for the chakras.
For the chakra sweep. Yeah. That mode is the gamma. That's for the brain optimization. Now, may do some other things, it probably does, but again, we're going to focus on what we know. You optimize the control center, that controls everything. That's just short of it. Third mode is the delta, and that's sleep, relaxation, and also decreasing neuropathic pain, but also overactive activity. Sometimes when I get too hyper, I don't sleep as well. I too much adrenaline, maybe a little too much coffee. Yeah, hey, listen, I'm a human, right? I put on a delta, and I'm better. So that's a wonderful question. Yeah, that's. Let's see what setting, and of course the sweep mode. And if you sweep mode was the original and the first mode that was there. The first device only had the sweep mode to begin with.
Yes.
And most people did very well with that. It's just that we introduced the portability. Now you can carry it with you.
Now you can sit on it in your car as you're driving.
Yep. And you can also literally you can work on your brain, and you can work on relaxation and reset. So those are the two new modes. But the primary and first mode in general mode is the sweep.
No other PEMF device includes the delta mode, or the sweep mode, or the gamma mode.
Very unique, isn't it? Yeah.
Okay, so that's unique to this device.
Yeah, because you'll hear a lot of the electromagnetic, and actually I did a summit with Dr. Pollack, who is one of the world's experts on this, really great guy as well. Really cares about what he does, knowledgeable. So we did a wonderful presentation, and I learned a lot about some of the other models. Again, I'm not saying everything has a value, but there's also some unique features to this as well. And I do want to say one more time that if a person did want to take advantage of the opportunity of the offer that we have for Dr. Shealy's birthday, one day left to take advantage of the 15% off on the PEMF, and also the 3 courses, biogenics course, self-regulation, basically your entire life's work right there. Youthful longevity, how to live healthy and happy to 100 and perhaps beyond. And personal intuition, plus a few supplements, and in other words, some of the basics, essentials, youth formula, magnesium topical lotion, and air bliss. And I think if a person wanted to get started on a health bundle, we all make New Year's resolutions for the first of the year. I'm going to make a suggestion. Take care of yourself now. Make a decision and take care of yourself starting from this moment on. And be happy, be healthy. It doesn't have to be the first of the year to start doing things.
And maybe you'll be 90 years old someday.
That's right.
Or beyond. Actually, now that you're doing so well, maybe, what do you say we go to 150 again?
Well,
Or go for
at least 110.
I was saying 150, it might get lonely, everyone you knew.
Right.
Okay.
Yeah.
We got this is a big question here. Is there a wrong way to use the PEMF? I don't think there is.
Well, yes, you should not use it in the bath or shower.
So not enough water, yeah.
Okay, so there's and the comment is there's this is from a paid client. I tried it under the pillow, but it felt better on the chest area. And you know what? That's exactly where it needs to be. Sometimes I put the intention of just literally okay, I'm going to use this mode and that and so on and so forth, and then I turn it on and I discover, hey, that's I'm doing better with another mode, either delta or the sweep. And some days I just literally keep it on sweep 24/7. Literally, that's when I'm really burning out or just doing too much or stress levels, and we all get stress. So that's literally regeneration, and they just keep it on.
That's the one we sit on all day at the office. We have
Yes,
we have the older
yes.
model, so we do that.
And that's
And it's
that's
good.
fine.
Yeah.
Yeah. But you got to be plugged in with the older model.
You do have to be plugged in with the older model, so that part. It's okay. We can do it. But doesn't mean we can take it in our cars or walk around the office with it. Yeah.
Well, yeah.
Yeah.
Okay, and I think let's see. We have another question coming up, I believe. Until further notice, I'm kind of checking this thing. So.
Well, and as he's waiting for that question to pop up, a lot of people do call and ask, where do I place it? And I just tell them where you feel like you need it, and there's not a wrong, kind of like we were just discussing.
Top to bottom.
Right. Okay. Perfect.
Yeah.
I'm
Absolutely.
telling them the right thing.
And some of the easiest ways, just like Dr. Shealy is wearing, that's what I do as well. I just keep it around all day when I get a chance. Other times I just plug it in and I just keep it under my seat. And that's, hey, I still get the benefit. Now, this is a good one. Difference between PEMF and the Fisher-Wallace cranial stimulator for depression. Now, cranial stimulator, now that's an interesting story, isn't it? Yeah.
Yes, I'm about to do a research project on a different device that definitely increases or decreases depression and anxiety, and hopefully it lengthens telomeres.
But let's not talk about that until we have the data.
No,
Okay.
Yeah.
yes.
That's enough coming.
Yeah, that's enough of
It's a year away.
Ooh,
Yeah.
but folks, keep an eye. Okay, now, but there's two existing devices that are interesting and wonderful for the depression and anxiety. And this came out that the Fisher-Wallace. Let me give you a little background, and Dr. Shealy will jump in here. It was initially called cranial stimulator, LIS cranial stimulator, when an engineer by the name of Liz, working with Dr. Shealy, literally put together this, and Dr. Shealy did the research showing that there is endorphins and serotonin, which gets improved in people with depression, anxiety, and literally helped a lot of folks. Now, what happened was that company is now Fisher-Wallace. They bought the unit. Unfortunately, for what happened was that unit is not used properly. Just like the TENS unit is not used properly. Why is it that people discover things the right way and then others mess it up? Why does that happen? I don't get it. I mean, if you have a good concept, just keep it. But anyhow, let's kind of get back to the basics. I carry the original version of the LIS cranial stimulator. That's literally a museum model, and it still works incredibly well. The Fisher-Wallace, I'm not saying it's a bad unit. It's just a different design. But what it does is, it's electric. You apply the two electrodes either to temples or back in front, and then you up the amplitude of the current, in other words, so that until you can feel it. It doesn't have to be overwhelming. It doesn't have to be very painful. Again, you just get to the place that you feel it, and then you'll see some flashing lights even with your eyes closed. And that's how you know the unit works. Usually between 2 flashing lights to 4 flashing lights. Sometimes, usually 2 to 3 is enough. It's a wonderful thing, but you use it in the morning before noon, because if you're gonna stimulate the endorphins and the serotonin, you want to make sure that serotonin gets a chance to be utilized during the day and convert it into melatonin at night. The company has advised, and if you have a Fisher-Wallace cranial stimulator, please listen carefully. The company is advising using it on I guess 15 to 20 minute basis, and including in the evening. That's not what the unit was invented for, folks. Absolutely not.
Stupid.
So thank you. I wasn't gonna say that, but thank you. Well, here comes the inventor. He can say that, right? So you're supposed to do it for 1 to 2 hours, for about at least an hour. Sometimes I use it for 2 hours. In the morning. The PEMF is not an electric device. It is electric, but it's electromagnetic. It's not electricity that's coming through. And with a sweep, with a gamma, with a delta, you're affecting the brain, you're affecting the tissue on a subtle level. It's not direct electricity coursing through. So it's a little less invasive, and I would say between the two, if you had to choose between them, what would you buy? The Fisher-Wallace cranial, or would you get the PEMF?
PEMF, DMF, PEMF.
And we can say that about 10 more times.
Right.
Yes, sir. Coming again from the creator. Hey, what else can I say? And I think, unless there's any other questions, I think we've been going on here for a while. Let's see. And that's it. So I'd like to kind of round things up by saying, well, we're going to celebrate Dr. Shealy's birthday in about 4 days. We're going to have quite a few people come on over and pay tribute and enjoy the company. In the meantime, we'll see you again in a week, and please don't forget to take advantage, if you're interested, of the offer that we just mentioned for the PEMF and all the other wonderful things that kind of go with it. One more day left. We still have a few units, and before we, supply demand is a little bit difficult. I'll just say this way, but there's no reason why every single household shouldn't consider having this wonderful device. But even more important, the concept of holism in their house, in their life, in their personal, in their mind, in their heart, and that's what it's all about. That's what we're all about.
And remember, heal is crucial to our name.
Oh, yes.
Yes. The heel in Shealy-Sorin.
Yes. Actually, the word heal is literally embedded in Shealy, isn't it? Mm-hmm. If you take away the S and you take away the last letter, it literally spells heal. Did you realize that when you were growing up?
Yes.
I knew he was going to be a neurosurgeon when he was 16. Of course he realized it.
Yes.
Well, so speaking of healing, unless there's any other closing words, Rachel, I know we've talked a lot more, but...
Yeah, no, I think I have covered the questions that many people have, so...
Okay.
Hopefully.
Yeah, and it's wonderful to have you. Literally wonderful to have you here. Thank you so much.
Thank you.
And Dr. Shealy, any other words of advice or wisdom for the folks, especially since you will be coming up on your 90th birthday? Lots of wisdom, lots of experience. What would you say to folks?
Relax and enjoy it.
Love it.
Well, there we go, folks. Relax and enjoy. And unless there's any other questions or thoughts, we'll see you next week. And we'll keep on going. By the way, we'll be switching over to a 4 o'clock instead of 4:05. So we'll be starting a few minutes earlier. Radio program was at 4:05. That's why we've had this pattern. But there's no reason to switch to the beginning of the hour. I think it's going to be less confusing. So next week, if you're following us, tune in at 4 o'clock Central and Wellness Wednesdays.
Thank you.